Imagine it's 9,000 years ago. You have a splitting, blinding headache that won't go away. There are no painkillers, no doctors, no hospitals. So someone you trust sits you down, picks up a sharpened piece of flint, and begins to cut a hole directly into your skull while you're awake. And here's the part that should stop you cold. You would probably survive. Not only survive, in some times and places, people who had their skulls cut open lived through it more often than patients did in actual hospitals thousands of years later. This really happened to thousands of people all over the world. So what on earth were our ancestors doing? And how were they so disturbingly good at it? Because here's the thing we get completely wrong about ancient humans. We picture them as helpless, dying young from every scratch and sniffle. But the truth is stranger and far more impressive. They had medicine, real medicine, some of it useless, some of it horrifying, and some of it so effective that we still use versions of it today. So let's actually find out what you would have done when you got sick, long before any of this existed. Let's start with the everyday stuff, the coughs, the wounds, the fevers. And here, ancient humans were not guessing blindly. They were walking pharmacists. Over countless generations by trial and error, and very likely by watching what sick animals ate, early humans built up an enormous library of plant knowledge. And a lot of it genuinely worked. They used willow bark for pain and fever, and here's the remarkable part. Willow bark contains salicin, the natural chemical that aspirin is based on. When you take an aspirin today, you are using a refined version of a remedy that's tens of thousands of years old. They packed wounds with honey, which sounds like folklore, until you learn that honey is a genuine antibacterial. It draws water out of bacteria and kills them, and it's still used on stubborn wounds in modern hospitals right now. They used certain clays to settle the stomach and treat wounds, the same basic idea behind some modern remedies. They chewed specific plants for toothache, used molds and fungi on infections long before anyone understood why, and knew which herbs would make you vomit out something poisonous. This wasn't magic, and it wasn't luck. It was a vast, hard-won database of what works, memorized and passed down by word of mouth for thousands of years. But plants can only take you so far, because sometimes the problem wasn't a cough. Sometimes it was a hole in your body or a spirit in your head. And that's where ancient medicine takes a sharp and shocking turn. Here's something crucial to understand. Ancient humans did not separate the body from the spirit the way we do. To them, illness wasn't just a physical malfunction. A disease could be an invading spirit, a curse, a punishment, something with intent. So the person who treated you wasn't just a doctor. They were a healer, a priest, and a magician all at once. We often call them shamans. And before you laugh at the rituals, the chanting, the smoke, the charms, consider this. The shaman was doing something modern medicine took thousands of years to rediscover and take seriously. Treating the mind to heal the body. When a trusted, powerful figure performs an elaborate ritual and tells you with total confidence that you will get better, your body responds. We have a name for this now. We call it the placebo effect. And it's real, measurable, and powerful. Belief alone can reduce pain, lower stress, and genuinely improve outcomes. So the shaman's magic was partly a delivery system for hope, and hope has real biological effects. They combined that with their plant knowledge, and the result was something far more sophisticated than we give them credit for. But the shaman's most extreme treatment wasn't a herb or a chant. It was a surgery. The one I described at the very beginning. And it's time to talk about what was really going on when they cut into someone's skull. It's called trepanation. Drilling or scraping a hole into a living person's skull. And it is one of the oldest surgeries we know of, going back at least 7,000 to 10,000 years. And it wasn't rare. Archaeologists have found trepanned skulls all over the world, Europe, Asia, and especially Peru, where it was practically perfected. This was a global human practice. Why would anyone do this? For a few reasons. Sometimes it was practical and, frankly, logical. If someone took a blow to the head and the skull was fractured and swelling, opening a hole could relieve the deadly pressure building on the brain. Modern surgeons do essentially the same thing today for severe head trauma. But other times, the reason was spiritual. To release the evil spirits they believed were causing seizures, headaches, or madness, letting them escape through the hole. Now sit with the reality of this. No anesthesia as we know it, maybe some coca leaves, alcohol, or herbal sedatives to dull the pain. No sterile operating room, just flint or obsidian tools, scraping through skin and bone on a fully conscious human being. It sounds like a death sentence, which makes the next fact almost impossible to believe. The patients survived, constantly. We know this for certain because bone tells the truth. When living bone is cut and the person survives, the edges of the hole slowly heal, growing smooth and rounded over months and years. When the person dies, the edges stay sharp. And when archaeologists examined these ancient skulls, the majority showed healing. One review found that around 70% of trepanned skulls showed signs of the patient surviving. But the truly staggering numbers come from Peru. A 2018 study led by researcher David Kushner analyzed around 800 trepanned skulls. In the earliest period, survival was about 40%, already shocking. But by the time of the Inca, survival rates climbed as high as 90%. Let me put that in perspective. During the American Civil War, thousands of years later, surgeons performing similar skull operations lost roughly half their patients. In Victorian hospitals in the 1800s, survival from the same surgery was sometimes under 10%, because patients caught fatal infections in the hospitals themselves. So an Inca surgeon with a sharpened tool and no idea what a germ was dramatically safer to be operated on by than a trained surgeon in a 19th century European hospital. How? They likely operated in the open air instead of disease-ridden hospitals, used fresh, single-use tools, applied antiseptic herbs and resins, and passed down refined techniques over generations. They had no theory of germs, but by trial, error, and observation, they had stumbled onto practices that actually controlled infection. The thing that should have killed everyone didn't, because they were quietly, genuinely skilled. This is the part worth holding on to. We tend to imagine our ancestors as primitive, fumbling, doomed to die from anything serious. But the evidence in the bones says otherwise. They understood plants well enough to build real pharmacies. They understood the mind well enough to use the placebo effect. And they understood the body well enough to cut into a living skull and have the patient walk away and live for years. They were not stupid. They were us, with the same brains, the same curiosity, the same desperate will to save the people they loved, working with nothing but stone, plants, and thousands of years of accumulated, hard-won knowledge. So what did ancient humans do when they got sick? They did what humans have always done. They paid attention. They remembered what worked. They passed it down. They comforted the dying and fought to save the living with the best tools they had. The next time you swallow a painkiller without a second thought, remember that the idea behind it was discovered by someone chewing bark tens of thousands of years ago. And the next time you think of ancient humans as primitive, picture this instead. A healer, working by firelight with a flint blade, performing brain surgery so carefully that 9 times out of 10, the patient opened their eyes again. They didn't have our knowledge, but they had something just as powerful. They had each other, and they refused to give up. That is where medicine began. Not in a hospital, but in the hands of people who simply could not bear to watch someone they loved suffer.